Hello, I'm Dr. Jeffrey Watson, and welcome back to this special edition of the Healthbeat Show. Right now, we are right in the middle of the coronavirus pandemic. And I say the middle, I'm wishing it was toward the end. We are here joined right now by none other than the great Gerald Greene. Mr. Greene I've known for a long time. He's an engineer, he's an author, and he's a survivor. He's been on the Healthbeat Show before, and he has now become the chairperson of the Frank Staggers organization, which deals with support groups for prostate cancer. Welcome to the Healthbeat Show, Mr. Greene.
Thank you. Thank you.
We're so honored that you were here. Now, we've got a big event coming up this week, August 22nd, August 23rd at the Eastmont Mall. There'll be a big coronavirus testing program. We'll have food, we'll have community outreach. How is it that your organization, where you are the chair, the Friends of Frank Staggers, became involved with this program?
Well, it started with our relationship with UCSF. The Friends of Dr. Frank Staggers is an offshoot of a prostate support group that I'm a part of. And we organized to do a walk around the Lake Merritt to bring more awareness to prostate cancer. That was to be June 13th, but because of the because of the COVID-19 issue, we had to postpone.
Right.
And we were going to do it in September, but again, it looks like it's not going to happen. So we were organized to do something, and we decided to pivot to COVID-19. And on Tuesdays, I've been having a noon meeting for the Friends of Frank, and there's another organization, the African American Rapid Response Committee, Health and Wellness Committee. I think Dr. Watson, you're on that one.
Right, and I think Arnold Perkins and several people
Arnold
from
Perkins
the county.
And Dr. Damon Francis and Dr. Abelardo. Well, they also decided that we need to do something with COVID-19. And because the Friends of Dr. Frank Staggers was kind of in a lead position, my committee became the kind of like the steering committee for a lot of the other nonprofits and other organizations. The meeting that I chair in less than a half hour from now will bring all these different groups together, especially the mobilization. You had Dr. Kim Rose on earlier, and a lot of the things that she learned and people she organized with in San Francisco are assisting us do this thing in our at Eastmont Mall.
Right, and she brought up a good point, which you reiterated just now, community engagement. And so she also was much involved with cancer, and she started to develop a network of support groups and community groups that dealt around cancer. And when we decided that this was the issue that we needed to take up right now that was affecting African Americans, those partners rolled into the COVID-19 pandemic, both screening, relief, support, all of those types of things. So she wanted to make sure that point was brought up.
And that's pretty much my key focus is to harness the energy of the other organizations, because we want to put our stamp. This testing is a community-led, and it can't be said enough. We're trying to recruit 1,000 African Americans to come out and get tested each day. I know that's not going to happen, but it would be ideal.
It could.
If we were giving away
what I was telling Gerald earlier, when we worked with Frank Staggers and we did prostate cancer screening, we gave away Viagra, we gave away Raider tickets, and we had a line around the block. But here, you are going to have a lot of wonderful things. You're going to have PPE, personal protective. I'll tell you, every day people ask me for masks, they ask me for the hand cleaning, and of course we'll have the testing, and these swabs do not have COVID-19 on them. We're not going to give it to you, we're going to test you for it. But there'll be free food. And I don't just mean food at the event. There'll be food for you to take home to your family. There'll be information on housing, social services, all these types of things. So that's worth standing in line for.
Yeah, and they're going to be a slightly different location from where the testing. If you're familiar with Eastmont Mall, the testing will be on the lower portion down by the institute called the Town Hall Center. The free food, the Black Cultural Zone, they're giving away the food. They give away excellent food. The free food, the other social services, it's going to be directly across the street from Roots. There's a lot that's being used.
So that'll be kind of down upstairs.
It's upstairs, maybe on the corner of 73rd and Foothill, and our event will be more on the corner of Church and Bancroft. So people familiar with the mall know that they're kind of opposite ends of the property.
So it'll be like a health fair. There'll be a DJ there.
Yes.
There'll be entertainment. You know, something I think is real important we didn't touch on. Everybody wants their kids to go back to school right now. How about getting your kids tested?
Yes.
How about getting your kids tested? My little nephews and nieces all got tested positive because one of them went out and played basketball in the hood with some other people out there. He got it, brought it home to all the brothers and sisters. So if we do think about going back to school, if my kids were to go back, which that's not going to happen anytime soon, I would want them to be tested, which I did test them. And I think other families would want their kids to be tested so they know at least my kids are safe.
Right. And part of the incentive behind this, July 4th, I was involved with the friends of Dr. Frank Staggers, and out in the county, we gave away free masks at Lake Merritt.
Yes.
And if you live in Oakland, you probably are familiar with the scene at Lake Merritt. It's kind of like nothing has happened.
It's a big party.
Yes, but those folks who are down there celebrating could be carriers of this COVID-19.
Some of them are getting sick. And that's a good point that you bring up. Frequently, the carriers and the people that give it are asymptomatic.
Yes.
It's not the person in the hospital with a fever, coughing, and on the ventilator. It's the person who's asymptomatic. What we know about Alameda County in the state, it's number 8 in terms of disease, and 8 also in terms of deaths. More than Santa Clara, more than San Francisco. So the Bay is a big hub. We're number 1 in the Bay, Alameda County is. So this is a situation that we can't be afraid of it. I was, pretty afraid of it at first because I'm right in the heart of it, both at the hospital and in the office. But this is a way for us to know how to be safe, to know that we're okay, and if we find that we're positive, we can direct you in the right direction.
Yes, and I come from a background, I'm a retired engineer, but if you want to get stuff done, you have to be proactive. You have to do. You just can't sit back and complain and accept. And I'm a big believer I don't believe in complaining about stuff. So if you want to, be productive, get out, volunteer, be in front. Now, I don't intend to be there, I don't think, swabbing stuff down on the day of testing. I'm 71 years old, so I'm a prime.
You're at risk. You're at risk.
So, but I am
But you
working.
can get tested.
Yeah, oh yes, my wife and I, we will get tested, but I am working religiously behind the scene, making things work.
And our group, James A. Watson Wellness Center, we're going to call back some of the positive. That's what we're doing, and then help them to figure out, okay, what do I do now? Where do I go? Where do I get supportive help at this time? And you're not a bad person if you were to come up positive, but we just don't want anything worse to happen to you.
And I think Dr. Rose explained earlier, UCSF is putting its funding also into the contact tracing, helping identify if you do come back positive, what can we do to minimize? And I would like folks to really understand that if you're not getting tested for yourself, think about your family. And I think everybody loves their mother. So think about your mother if you want to be hesitant about getting tested.
She brought up something really important, and it's about what you just said, exponential spread.
Yes.
Just like you said, it's not just about me, it's about my kids, my wife, my mom, my grandma, my cousins. You know, if I bring it home, am I going to give it to everybody else? And some of them are young, they might do okay, but then there's others that are older. My mom's 96. She probably wouldn't be able to tolerate that.
Oh, my.
So exponential spread is, we want to, look at that. And respondent-driven sampling. We're going to be doing the nasal, and we're going to be doing the blood too. If you want the blood to see if you have an antibody, and maybe if you have an antibody, maybe you're resistant, but we don't know that for sure. And some people who've had it, have the antibody, may want to donate their plasma, because the plasma is being used to be given to people to fight the virus. It has the antibodies in it to fight it. We also have a new intravenous drug called remdesivir, which is a HIV-like medicine for people who are in the hospital with COVID-19 pneumonia. So there are things that can be done, and we want the folks, our patients, to be knowledgeable, so that if something does come up, we can make sure that they get taken care of. Don't be afraid. Let's interact. Let's figure out what needs to happen if somebody gets sick. So August 22nd, August 23rd, Eastmont Mall, the main stuff testing on the lower level. There'll be a DJ, free food, lots of giveaways, giveaway personal protective equipment, interaction with other healthcare providers and other people from the community. The other thing you brought up, so important, this is a community-driven program. It's not a Caucasian machine that is putting this on. It's us volunteering, giving our time to help the community. And so we really appreciate you being with us, Mr. Gerald Greene, author. You've written books. I've read your books. At least one. You're still working on the second one?
I'm working on the second one. I have some articles, and I have been co-authoring another book, so I'm spreading around. I'm working on one on prostate cancer now.
Okay, a survivor of prostate cancer.
Yeah, survival, and also looking at cancer from a black man's point of view. Our disparity is much higher than other folks.
Right. Well, we know that African Americans make up 12% nationally of the population, but maybe 25% of the deaths. So there are disparities in disease. And as Dr. Rose pointed out, when we get it, we die at a more rapid rate than do other races, even than the Latino race. Okay, I'm Dr. Jeffrey Watson, right here with Mr. Gerald Greene. He is the board chair of the Friends of Frank Staggers. He is really involved with developing the program that's going to be August 22nd, August 23rd at the Eastmont Mall. I encourage you to come out. I'll be there. We'll have other of your friends there from your churches, from your community. Let's get together and provide unity. I'm Dr. Jeffrey Watson, telling you always that your health is your wealth, and when you have your health, you have everything. We'll see you next time. Hello, I'm Dr. Jeffrey Watson, right here from the Healthbeat Show, encouraging you to come out to the Eastmont Mall on Saturday and Sunday, August 22nd and August 23rd, for a COVID virus screening. We're having a big event. There's going to be food there. There'll be a DJ there. We will be talking about housing, social services, supportive programs, but we will also be testing for the coronavirus. It is free. There is no virus on this Q-tip. This is geared toward African American patients. There are disparities in disease, and we're finding that when African Americans get the COVID-19 virus, they seem to die at a greater rate than many of the other racial groups. We'll be joined by a lot of community groups, by Roots, by the West Oakland Health Center, by your church, by your community groups, by the Friends of Frank Staggers, all types of organizations, and we're here for you. This is put together by you, for you, community groups. University of California, San Francisco will also be supportive, but they are not in charge of this event. You are in charge of this event. We will be giving away also free personal protective equipment. How many of you need a mask? We'll be giving away hand sanitizer also. All of these things will be free so that we can make sure that you are healthy, because you're always going to hear me say that your health is your wealth. And when you have your health, you have everything. I want to see you August 22nd, August 23rd at the Eastmont Mall. Come out, get screened. I'll be there. I'll be getting tested too. It'll be just me and it'll be you. Okay? A whole bunch of folks there testing, supporting, having your back. And if you do come up positive, we'll tell you rapidly within a few days, and we'll also direct you on what to do. If you don't have health care, we'll direct you to appropriate health care and supportive mechanisms. Okay? I'll see you there August 22nd, August 23rd, Eastmont Mall, lower level parking lot. It'll be a wonderful day. I'll see you then.